My name is Kirsty and I'm a community learning disability nurse. Learning disability nursing is all about supporting people with learning disabilities to access equal health care, to optimise their own health outcomes.
So I'm Katie and I'm a children's nurse, and children's nurses basically meet the health and wellbeing needs of children and young people, both their physical health and their mental health, and you can find us both in the community setting and also in the hospital setting.
I'm Ian, I work in mental health nursing, and that largely involves working with people's thoughts, feelings and behaviours when it becomes an issue or a significant problem for them.
My name's Gary and I have a background in acute care nursing. Acute care nursing is when we care for people who are often admitted to hospital as an emergency and who need immediate care depending upon what's caused them to come to hospital. I went into nursing because I really wanted to make a difference to people's lives, to work with people when things are tough and to actually try to help them to feel better and to actually to help them feel that their dignity, their privacy and that they're being respected at all times.
I childminded some children, and two of those children were challenging at times, and when I stopped I was surprised that other people struggled to take on those children. And that made me realise that actually I'd got a skill in seeing the person beneath the challenges, beneath the disabilities.
I think really the main reason being that I was unwell as a child. It affected the whole family. I was in hospital for a long time, received fantastic care from lots of different professionals and decided that this was the way that I wanted my career to go.
If you can be warm and genuine, you can make good relationships with people, it's half the battle, because especially in mental health you have quite close relationships with the people you work with. There are boundaries in your relationships, but people need to feel confident and comfortable with you.
Qualities that are really important for children's nursing are firstly to be an excellent communicator, obviously dealing with children, caring for children across the age range, so you need lots of different communication skills for that. Being adaptable, being resourceful, and I think having a sense of humour as well is really, really important.
Now Sean, he's got a little straw in his hand.
A learning disability nurse needs to be patient, needs to think out of the box, needs to do things in a different way, needs to have the time and the understanding and the willingness to get to know people.
For acute care nursing, you've got to be a person who is calm, who is kind and who can show compassion to all patients, no matter what they've done before they come to hospital. In an accident emergency setting, you've got nurse practitioners who can actually see a patient, can actually order an X-ray, for example, can interpret the X-ray, give the treatment and then discharge the patient home. Thus, the patient doesn't even need to see a doctor.
Learning disability nursing has changed dramatically. Even if you look back 30 years, there were still institutions and big hospitals for people with learning disabilities. All the nurses would work on the wards in the hospitals, and many of our patients were patients in an inpatient hospital. Nowadays people live in the community, hence the need for community learning disability nurses, and people access the same services as anybody else would access.
Children's nursing has changed in that when I was a little girl, my mum wasn't allowed to stay in hospital with me, which was incredibly traumatising. Thankfully, that's not the case anymore. There's been lots of work carried out, and it's now recognised that parents are central to the care of children and young people, so are encouraged to stay, be involved participants in care.
There's now much more working together. So you're part of your recovery journey, so you're involved in what options that your treatment might involve and what options that your journey to recovery might involve.
In my area of nursing, the rewards are immense, absolutely immense, even if it's just going in to see somebody with a profound disability who smiles because they recognise you, or somebody that has had real problems in accessing something because of a behaviour perhaps that they display, and through your work you can support them to achieve a goal. It's fantastic.
certainly the variety. You never know what you're going to be doing from day in, day out, which is very, very exciting in some ways. The lifelong learning, you learn every day something new, that never ends. And I think the most important thing for me that I see as the best bit is really the privilege that we have of being able to have a glimpse into the lives really of people with ill health, children and families, and help them along the way. It's a really privileged position and shouldn't be taken lightly.
There's a diverse opportunity for where you can practice nursing. There's lots of different opportunities within the mental health field. But for example, you could be anything from a breast care nurse to a diabetic nurse specialist.
My life in nursing, I would say humbling, moving, rewarding.
If you're thinking about going into nursing, you're going to have to work weekends, you're going to have to work shifts, probably long shifts, you're going to have to work Christmas, you're probably going to have to work when you'd rather be out with your friends. But the positives are that you'll work as a team, you'll actually be really rewarded by the feedback you get from patients, and hopefully you'll go home feeling that you've done a really good job and made a difference to a patient's life.
How to sum up my life in nursing in 3 words? I would say passionate, I would say committed, and I would say energised, have loads of energy, or possibly best decision ever. I think probably are the best 3 words.